The Syrian crisis, which began in 2011, has displaced millions of Syrians. As a result, Jordan has taken in more than 1.2 million Syrian refugees, further compounded by multiple waves of migration due to regional conflicts over the past 7 decades. The Zaatari Refugee Camp has become home to around 80,000 people, making it one of the largest refugee camps in the world. This rapid population growth, along with the camp's complex layout, has created numerous challenges in providing essential services. The primary concern within the camp, as identified by both societal perceptions and the camp's organizational structure, is the barrier to accessing medical services. This research aims to address this issue, which is influenced by 4 key factors. Firstly, distance, lack of transportation, and scarcity of facilities, along with the widespread adoption of unsafe remedial practices. And most importantly, a lack of community engagement with available services. The circumstances related to healthcare in the Zaatari Refugee Camp, which is managed by UNHCR, pose challenges to the achievement of Goal 3 of the United Nations Sustainable Development Goals, which refer to ensuring good health and well-being. The research aims to improve the lives of refugees in Zaatari by enhancing their access to primary healthcare services, promoting good health and well-being in this highly vulnerable community. Chosen approach for this project is research by design, with a strong emphasis on research in the design brief. Based on the research findings, an acceptable walking distance to a healthcare service for patients is identified as 400 meters. According to WHO standards, the target ratio for healthcare facilities is 2 per 10,000 people. The population of Zaatari Refugee Camp is approximately 80,000, but the ratio of healthcare facilities to the population is less than 1 per 10,000. Additionally, many people do not have a walkable distance to the nearest facility. Primary health care is often provided by humanitarian organizations or local health authorities in refugee camps. The first health facility and community health activities are supportive communal elements in establishing successful primary health care. The Zaatari camp is divided into 12 districts with existing healthcare facilities identified and their respective walking distance mapped. Based on walkable range of these facilities, areas with a scarcity of healthcare services have been identified to support the proposal's initiation. Primary healthcare facilities are recommended for establishment within the camp based on research findings, and these healthcare centers are interconnected with the central hospital via a central axis offering intermediary resting pods. The proposed project introduces a modular typology for primary healthcare facilities across various districts. The placement of the healthcare facility was done considering the socio-cultural aspects of the neighborhood. The design project, driven by research, is primarily focused on enhancing physical accessibility by considering factors such as number of patients, disabilities, and stigma. The design identifies desired paths, pathways for extension, creates open spaces to encourage movement, and strategically positions building edges to enhance accessibility. It also addresses wayfinding by maintaining uniform building heights that integrate with the surroundings and highlights specific block for visibility. 4 entrances, including main and sub-entrances, are designed to maximize accessibility and prioritize pedestrian flow. The second driver emphasizes cultural sensitivity, inspiration connecting to Syrian traditional architecture. The central courtyard is modified to improve connections between blocks. Internal block shapes are adjusted for movement, and internal steps are repurposed for various activities. The design integrates enclosed facades with exposed structures to correspond with the surroundings. Traditional ventilation strategies such as elevated flooring and wind towers are utilized for natural ventilation. The third driver examines community-centric design, creating spaces for social interactions both inside and outside the building. Blocks are positioned strategically to merge the boundaries between internal and external spaces, encouraging informal courtyards. The design also scales up one block to serve as a navigation landmark and symbol of the community's identity. Driver about sustainability emphasizes using recycled materials for construction, including scaffolding, steel pipes, and metal sheets from disused caravans. The choice of feasible grid for structural elements enhances stability and adaptability, allowing a broader range of design possibilities within the structure. This research explores the use of research-based design strategies to create value-free healthcare facilities, aiming to enhance performance in healthcare environments. By testing these strategies through working models, the project seeks to improve access to primary health care for refugees in Zaatari Refugee Camp. It could serve as a model for similar efforts in refugee camps worldwide, and the comprehensive approach to research-based design presents a valuable contribution to the field.